BBLs and fat embolisms, it's one of the major complications that we all worry about, and you would be concerned about too as a patient. So if you're thinking about getting a BBL, you're going to come across this term fat embolism. Now, there have been a lot of advances in the field that have actually taken that risk and decreased it. And I want to review those things with you today. This is the butt. We've done a little cross section. I got skin, I got butt fat, I got butt muscle, also known as the glutes. And you'll see running from this, I have blood vessels. They go from below the muscle all the way up to the skin, because that's how we get nutrients. That's how we take away waste. Now you can see way down here in the muscle, they're very, very big. And actually below at the bottom of the muscle, they're even bigger. So one of the ways that we got fat embolisms was that fat could get placed too low, or fat could migrate too low once in the butt muscle and end up in these veins. And these veins could then go to the lungs and cause a fat embolism. So how do we make sure that we don't end up too low in the muscle or stay out of the muscle entirely, which is what we do in the US. We actually don't go in the muscle at all. Well, we utilize an ultrasound. So we can put ultrasounds. They look like this now, totally wireless. They just broadcast to an iPad. It's kind of crazy. You put the ultrasound up while we're doing the injection, and we can literally see this cross section. Look exactly like this. We can see where blood vessels are. We can see where blood vessels aren't. We can see where the muscle is. We can see where the fat is. And we know if we stay in these areas of the fat, we're not going to be in the danger zone, and we're not going to be at risk of the fat embolism. And that's one of the super cool things that technology has allowed. It's allowed us to take our risk of fat embolism and reduce it to almost zero. Now, there are certain places that you'll inject, like hip dips or other areas that are not in what we consider danger zones. And so maybe surgeons will not use ultrasounds in those areas, and that's totally okay. Or maybe they're using such a small amount and they're putting it right underneath the skin that they're not concerned about it. Again, that's okay. So please always check with your board certified plastic surgeon and ask them about the use of ultrasound and why or why not they're using it when they're injecting fat in the butt muscle.